Vitamin B12, also known as cobalamin, is a water-soluble vitamin that plays a crucial role in the proper functioning of the nervous system, the production of red blood cells, and the synthesis of DNA. It is an essential nutrient that cannot be produced by the body and must be obtained through the diet or supplements. The absorption of B12 in the small intestine requires the presence of intrinsic factor, a protein that is produced by the stomach. B12 deficiency can lead to various health problems, including anemia, neurological problems, and developmental delays in infants and children. Hello and welcome to our video on B12 deficiency. If you're new here, don't forget to hit the subscribe button and turn on notifications so you never miss out on our informative content. In this video, we will be discussing what doctors won't tell you about vitamin B12. B12 is an essential vitamin that plays a crucial role in maintaining our overall health. However, many people are deficient in this vitamin, and it can lead to various health problems. In this video, we will be discussing the causes, symptoms, and treatment of B12 deficiency and also tell you who are more vulnerable to B12 deficiency. So, let's get started. 1. What is B12 deficiency? B12 deficiency is a condition that occurs when the body does not have enough vitamin B12. This vitamin is essential for the proper functioning of the nervous system, the production of red blood cells, and the synthesis of DNA. B12 is found in animal products such as meat, fish, and dairy products. However, some people may not get enough B12 from their diet, and this can lead to a deficiency. 2. Causes of B12 deficiency. There are several causes of B12 deficiency. One of the most common causes is a lack of B12 in the diet. This is especially true for vegetarians and vegans who do not consume animal products. Another cause of B12 deficiency is a lack of intrinsic factor, a protein that is necessary for the absorption of B12 in the small intestine. This can occur in people with pernicious anemia, an autoimmune disease that attacks the cells that produce intrinsic factor. Other causes of B12 deficiency include gastrointestinal disorders that affect the absorption of B12, such as Crohn's and celiac diseases. 3. Symptoms of B12 deficiency. The symptoms of B12 deficiency can vary from person to person. Some people may not experience any symptoms, while others may experience severe symptoms. The most common symptoms of B12 deficiency include fatigue, weakness, and lightheadedness. Other symptoms include pale skin, shortness of breath, and a smooth tongue. In severe cases, B12 deficiency can lead to neurological problems such as numbness and tingling in the hands and feet, difficulty walking, and memory loss. 4. Diagnosis of B12 deficiency. B12 deficiency can be diagnosed through a blood test that measures the level of B12 in the blood. However, it is important to note that the normal range for B12 levels can vary depending on the laboratory that performs the test. In addition to a blood test, your doctor may also perform other tests to determine the cause of your B12 deficiency, such as a test for intrinsic factor antibodies or a test for gastrointestinal disorders. 5. Treatment of B12 deficiency. The treatment of B12 deficiency depends on the cause of the deficiency. If the deficiency is due to a lack of B12 in the diet, then increasing the intake of B12-rich foods or taking B12 supplements can help. If the deficiency is due to a lack of intrinsic factor, then B12 injections may be necessary. In cases where B12 deficiency is caused by gastrointestinal disorders, treating the underlying condition can help improve B12 absorption. 6. Prevention of B12 deficiency. Preventing B12 deficiency is important for maintaining good health. One way to prevent B12 deficiency is to consume a diet that is rich in B12, such as meat, fish, and dairy products. For vegetarians and vegans, consuming B12 fortified foods or taking B12 supplements can help prevent deficiency. It is also important to treat any underlying conditions that can affect B12 absorption, such as gastrointestinal disorders. 7. People more vulnerable to B12 deficiency. 1. Vegans and vegetarians. Since B12 is primarily found in animal products, those who follow a vegan or vegetarian diet may be at risk of B12 deficiency if they do not consume fortified foods or supplements. 2. Older adults. As we age, our ability to absorb B12 decreases, which can lead to a deficiency. Older adults may also have gastrointestinal disorders that can affect B12 absorption. 3. People with gastrointestinal disorders. Certain gastrointestinal disorders, such as Crohn's and celiac diseases, can affect the absorption of B12. 4. People who have had gastrointestinal surgery. If you have had surgery to remove part of your stomach or small intestine, you may have a reduced ability to absorb B12. 5. People who take certain medications. Certain medications, such as proton pump inhibitors and metformin, can affect B12 absorption. 6. Infants and young children. Infants who are breastfed by mothers who are B12 deficient may also be at risk of B12 deficiency. Additionally, young children who consume a diet that is low in B12 may be at risk of deficiency. However, it's important to note that anyone can develop B12 deficiency if they do not consume enough B12 in their diet, or have a condition that affects B12 absorption. In conclusion, B12 deficiency is a common condition that can lead to various health problems. It is important to be aware of the causes, symptoms, and treatment of B12 deficiency to maintain good health. If you suspect that you may have B12 deficiency, it is important to talk to your doctor and get tested. Remember, prevention is key, so make sure to consume a diet that is rich in B12. And treat any underlying conditions that can affect B12 absorption. Thank you for watching our video on B12 deficiency. We hope you found it informative and helpful. If you have any questions or comments, please feel free to leave them in the comment section below. Don't forget to subscribe to our channel for more informative content on health and wellness. We look forward to seeing you in our next video. Take care and stay healthy.